best practices sharing by Johnson & Johnson team. So may I request Ketan Diwan, he's part of the engineering department and leads various projects. Joining him is Purba Saha, who is leading various strategic projects, and Preeti Duggaraju, who is the talent acquisition leader out there. Welcome, team.
So first of all, thank you to People Connect and Cargill for arranging such a beautiful event. On behalf of Johnson & Johnson, we are really privileged to be here, and we are happy to share what we know about driving excellence in manufacturing. And let's start away with the agenda is pretty simple. The presentation is pretty short, and we will go through a quick introduction of the team, overview of manufacturing of excellence at J&J, what is the role of technology and data in manufacturing excellence, importance of human capital, empowering women in manufacturing, and two very quick case studies. So before we jump into it, I would like to state that since morning, the discussions that are happening here, you will all see all those discussions, all those topics embedded in the presentation as we go through it. So I am Ketan Diwan. I basically lead process engineering, sterilization, and digital projects for J&J. I am based out of Ithicon, Aurangabad, which is a suture manufacturing organization. And along with me, I have really two dynamic women in manufacturing. Purba Saha, who is our officer in NPILCM project, which is a new product introduction, and she supports all the strategic initiatives for J&J. And we have Preeti Duggaraju, who is our talent acquisition manager and supports medical as well as pharmaceutical sectors of Johnson & Johnson. Okay. So before we actually jump into the case study, there are a few things we want to share, and then you will see that how those things have translated into the successful case studies that we are presenting today. So let's see J&J in numbers. So we have presence in two business segments, which is pharma and medtech. We have 135 plus years of legacy of excellence, 257 plus operating companies, and 140,000 plus employees worldwide. So with all these numbers, J&J is always working and striving towards manufacturing excellence. Okay. So as you must be aware of that, now even Tata also presented that there are different pillars that we have in manufacturing, and I just want to present few. So quality, safety, productivity, and people, these are our main pillars under which Johnson & Johnson runs a lot of programs, and I have mentioned only significant few here. I'm not going to go into the details of everything, but there are few things like I prevent and proactive quality, wherein we always want to think, which is one step ahead, that before anything happens, what can we do? Okay. Then in terms of safety, we have integrated ownership of safety systems, wherein there are different safety committees for each and every area of safety, which ensures that the people who are working in manufacturing, they are in a safe environment and they can focus on really what matters. In productivity, you all aware lean manufacturing, SMED, digital and technology roadmaps, and in people, our credo. So basically, Johnson & Johnson is very famous about the credo, the way of working, and anything and everything that we do is around our credo to ensure that whatever we are serving to our patients is the best quality product, it is safe for them. Can you change it? Yeah. So quickly, what is the role of technology and data in driving manufacturing excellence? So Johnson & Johnson basically promises to their patients that we will be faster, more flexible, more predictable, more efficient, more resilient, and more sustainable to give all the products that we make in a quality and in a safer manner. So, as I said, Johnson & Johnson is spread worldwide, and there are a lot of segments that we run, but there are three significant factors that I would like to put light on today.
that Johnson and Johnson is just beyond, the Johnson's baby soap. And what do we do? Do you all have any idea? Yeah. So I'll just give you all a small introduction about J&J, what we do. We have two major divisions. Earlier, we also had the consumer business, which is the Johnson's Baby, Sanpro, which is a stay-free, and then we also have the Benadryls and the Glycerines of the world. That business is a separate unit right now and a legal entity, completely. And what we have at J&J is two major businesses, which is the pharmaceutical business and then the medical devices business. So the medical devices business, currently we are representing that, focuses on two aspects. One is the Ethicon sutures. Anybody who would have had a cut or anything, they must have had a stitch, right? That suture is actually manufactured by J&J, and it must have touched almost every one of you because we are the market leaders there. The second biggest thing is the implants. I'll just finish this and then I'll hand over. So we have implants, which are knee replacements, hip replacements. Then we also have wound closures and staples, which we work with instead of a suture if you want to use this. So these are called as one Ethicon business, which manufactures sutures and staples. And then we have the Depusynthes, which have all kinds of implants. And then we have cataract and eye related, which is called the Vision, where we have cataract lenses, as well as phaco machines, which are basically used in the surgical equipment for eye surgery. I'll just pause here because we are back.
No, Preeti, thank you so much for the filler, and we apologize everyone for the gap.
Okay, I think people want me to continue with the Okay. So we're done with medical devices. The second biggest business, actually the world's largest business, is the pharmaceutical business. In India, it's a very small business because we are not into, there are two categories in the pharm business. One is the biosimilar products and the other one is the super specialty. Super specialty is something exclusively for your own entity. Okay, we are back. But generic products is not something what J&J operates. We are into super specialty molecules. That's oncology, which is cancer-related drugs. Immunology, which is autoimmune disorders. That's what we do with. Central nervous systems, which is related to mental health and other things. And then we also have cardiovascular and infectious diseases and public health. So the TB, which we are working on a campaign with the government of India, we actually have a tie-up with them to eradicate TB because we have the world's largest deaths because of TB. And we are in partnership with the government of India to eradicate TB as much as possible. Yep, this is the farm business of J&J.
Thank you, Preeti. So, to keep our promise, so I would like to shed light on three things that J&J is doing. First thing is roadmaps. So basically, we believe in having 3 years, 5 years roadmap of technology and digitalization, which will tell us that in which direction we want to go. Second thing is centralized solutions. Why centralized solutions? Because J&J, as I said, is spread throughout the world. There are different sites which are manufacturing the products, which just now Preeti told. So we develop technology communities throughout the world which collaborate with each other, share their experiences, share their knowledge, because there are a lot of similarities in the manufacturing machines that we have throughout the world, and that help us to prepare and produce better quality product for our patients. And third thing is innovation for simplification of the work, because nowadays there are a lot of things that are getting complicated, but still we have to drive the simplicity so that we can work with ease. Few examples like going paperless, human-machine synchronization, and in the morning we have already seen about AI. So we are also trying to implement AI to do monotonous and repetitive tasks so that the people, instead of doing those tasks day in, day out, can we channelize their talent, their energies into something for development of something new, which can be more valuable and can add value for the organization. So these are the three things that we are working on in terms of technology. And in terms of data, so basically through all these plants and all these organizations that we have under J&J, huge amount of data is being generated every day, and if we don't channelize the data, don't analyze the data, and find out the right actions, then we are not going in a right direction. So we have different Power BI dashboards, machine data, with which we find out what are the specific actions for the improved uptimes of the machine. We want to understand which are the areas of improvement, opportunities for cost saving, and needs of partnership with the lot of technology and new innovations that are coming up in the market. Can we work with them and produce more and produce a better quality product? And with that, I would like to hand over this to Preeti so that she can shed light on importance of human capital in achieving manufacturing excellence.
Thank you so much, Ketan. People are at the center or at the core of what we do at J&J. So we do at two different levels. One is what do we do for our internal employees, and what do we do outside of the organization for the communities, and how do we kind of build a diverse force for our organization. Skilled force, innovation is again the thriving factor that we all want to achieve, because we've been successfully been the most innovative organization in competition with Apples and the Microsofts of the world, and we are heavily investing in our R&D portfolio, continuously innovating. We need to keep that. I think we need to create people. We need to create a talent pool that's very, very critical, and that contributes to our vision. And how do we do this is we create customized learning experiences. We have, at a leadership level, we have designed some programs that are exclusively, help them accelerate in their careers. At a person who's starting at a university level, there are certain programs that have been designed for them. But overall, if you look at it, there is 2-3 platforms that everyone can actually, grow. One is a J&J Learn, which is a digital ecosystem for, building up your own upskilling and for developing your own skills. The second one is Grow. So how does a Grow assignment happen is, it is a stretch assignment. We release that there is a portfolio. You sitting in India can work for a project which is based in the US. So the Grow is a stretched assignment in addition to your work. This actually will help them in building experience and exposures, which are not on the job, not regularly available, because our scale is pretty small compared to a lot of your other organizations which are there. Now, how do we create it? We create through stretch assignment, and these are globally available for anybody. You could just apply, you get interviewed, and then you get selected. The third one is we continuously focus on our digital skills. Every year, everybody who needs to be invested in their digital upscaling, and these are 3 tools and platforms that our employees can have an enablement for. Now, how do we actually build the diverse workforces? We have a big challenge in manufacturing. I think, Anjali was talking about in the morning. We have 9% people sitting at the, at a workforce available for anything beyond in a STEM roles. Now, what do we do there is we build it at 3 levels. If you look at it at a starting of the level, we are about 48% women across India. 48% actually study science up to their 11th or 12th. But you see a significant drop when they move into universities, and that drops to 42%. And from 42%, when they actually take up a STEM career, they drop to about 9%. So if you look at it, we are at about 50%, all studying science, dropping to 42%, and then dropping to 9%. We want to address right from the beginning. And then we have 3 programs. One is at a youth level, which focuses on 8th to 12th, 8th standard students to 12th till they finish. How do we inspire them STEM? How do we make science fun for them? How do we instill a lot of initiatives around, making STEM as not a burden and or not as something that not as a very interesting thing, but more as a fun. Every year, we have 50 volunteers from J&J supporting and touching about 1,000 students across schools, and all of these schools are underprivileged schools, which are closer to the community that we work in. This is a community impact program. Now, at a university level, we do 3 different programs. One is Imagivators, STEM 2D Imagivators, where students come and experience what J&J is. What do we do at, what do they understand? Because a lot of y'all sitting here today, J&J stands only for a baby product. We didn't know what J&J is. In order to attract a great university talent, they need to know what J&J does. So we have a 2-day immersion program where students are called, 50 students are called to the campus, and they actually work with leaders for a 2-day, understand what they do and what is J&J offers, and then they go. Then we have a J&J University mentorship program where we have global leaders in actually engaging with STEM students who are at an engineering. And then there is a case study competition which is exclusively for STEM students. Our touch points, if you look at it, that's how we measure. We actually actively engage about 20,000 students every year. So our touch point is just not hiring. We also look at it, how do we engage with the university students? Because if not for now, tomorrow they are actually our potential candidates. The third one is the professional pillar. Now, professional comes into anybody who's internally as well as externally there. And a couple of things that we do is, one is a return to work program where we have Reignite, which is a global program where we welcome women to come back into workforce. And the other one is we have stirring mentoring programs and career fairs. And then there's targeted grow. When I said targeted grow, we have exclusively digital and STEM related grow assignments that are given for women employees so that they can accelerate in their journey faster. The touch points are about 1,000 and it ranges up between 1,000 to 3,000 every year. That's the growth. These are few of the programs that we do to accelerate women who are within the organization and to continuously engage talent pool which is outside. I'll hand over to Purva, who will be taking all through the case studies.
Thank you so much, Preeti. So my colleagues have set the tone for technology, data, and human capital, and how we are achieving manufacturing excellence by combining all of them. So, अभी आप सब लोगों को पता है सूचर क्या है? At some or the other point, you must have burst your head. So this particular suture that we are manufacturing at Ethicon Aurangabad, so I'm going to present 2 case studies in front of you, 2 very favorite business case study of J&J. So as earlier Ketan has mentioned, so we have 2 sectors, medtech and pharmaceutical. This is from the medtech industry. So at site a few years back, we had 4 manual operations. The first operation is chemical tipping. So chemical tipping is basically our operator is taking a suture and tipping into a chemical solution which hardens the tip of the suture so that there is ease of swedging. So what is swedging now? Now swedging is nothing but a needle and suture attachment. So every day an operator is swedging up to 2,000 inches per day. And it is followed by inspection, that is sample-based inspection, and cutting, that is based on product specification, cutting is done. Now we are combining all these 4 operations into one machine, which we proudly call as flexible automatic swedging machine. So what is this FAS machine doing for our business and for our patients? So we are touching 3 times more lives. No one has to wait for us. So we are there for a patient even before they need us. And 100% testing of products. So we are making sure that each and every product that our patient they are receiving, it's 100% tested and verified. So we are replacing manual sampling inspection with 100% testing. And 75K cost saving per year, because as much as we care for our patient, we care for our business too. And we have 75% reduction in human dependency and 100% improved safety. So we try to eliminate the exposure of chemical handling of our operators. So with that, with 100% improved safety due to elimination of chemical handling, we are able to achieve that. Moving on, this particular machine is pretty much close to me because thanks to leaders like Ketan and Preeti, they have given me the opportunity to work on this machine along with my other colleagues. So in the last machine, in the last FAS machine, we have seen we are integrating 4 operations into one machine. But in this particular machine, we are integrating 7 machines into one machine. So primarily what this machine does first is it applies, it prints the product labels. Second is it applies the product labels onto the product. And the third is the sealing of the product. So these are the 3 major primary functions that the machine is doing. So what does it do for our business? So since we are all from manufacturing, we understand the perils of reducing the cycle time. But with the help of this machine, we are reducing the cycle time by a whole of 10 days. And 28.5 million customers we are trying to serve with the help of this machine. And 100% online inspection of products. $300K USD in savings. And 100% machine guarding safety standard implementation. and 72% reduction in human dependency. So when I say reduction in human dependency, we are not replacing humans with technology. And Preeti can back me up here saying that J&J doesn't believe in layoffs. So with the help of this machine, we are trying to upskill our employees in such a way that they are able to come up with more and more of this magic, because these two machines, they are J&J patent technology. We have developed this machine and we have tailor-made as per our product requirements, customer needs, and quality management system. So with these two machines, we are able to address our 4 pillars, that is quality, safety, productivity, and people, and we are trying to achieve more and more excellence because we truly believe in for the patient, by the patient, of the patient. Thank you so much.
Yeah.
Yeah.
Right. So if you see the 7 machines, that means you need to have 7 what we call as PM checklist, that maintenance checklist, calibration checklist, and everything. When we are integrating it into one machine, that time we basically have the schedule only for one machine, and when OEM is giving us, OEM means original equipment manufacturer, when he is actually manufacturing machine, we are doing a kind of a study saying that what problems we have seen in this earlier machine when they were operating individually, and when we are integrating into one machine, what best can we do to minimize the breakdowns, because you must have heard the term OEE, so overall equipment efficiency, and when we do that, at that time we study each and every breakdown, we take action on it, and we basically ensure that those breakdowns are not getting repeated. So over a period of time, we have seen significant improvement in FAS, and the IFM machine which we are developing right now, it is almost in end stage, and all the learnings we are integrating into that so that in future we don't have breakdowns, and maintenance is easy to do basically. Yes, so we count that. So it is part of OE, you have to count that. Any other questions? We'll be happy to answer. Yes, sir. Absolutely. So all these machines. So basically, we follow ISO standards for our all the manufacturing processes and all the machines, and all these machines are SCADA and PLC based, and we are now integrating it with the IoT platform also. So basically, to understand, to take the machine data and to understand what kind of more improvements or what better we need to do on the machine. So, and ultimately what we have a plan is basically to digitalize even the OE system, which we are working with the global solutions, wherein from the PLC and SCADA only all the data will go into the dashboard. It is ready for you to analyze. Just start working on it and save that time, wherein you have to analyze, directly work on the machines to improve it. So we are doing that. Thank you for your question. I hope it answers. Yeah, thank you. There is one question.
Hi. You mentioned you achieved an efficiency of 72% human dependency.
Yeah.
Right? So what all initiatives J&J did to use that savings of efficiency which has been?
Very nice question. So when we say we have, let's say now 4 operations have been integrated into one. So because earlier those 3 machines were operated, 4 machines were operated by one operator. Now there is only one operator who is actually managing the new machine. So what we are doing is, what Preeti has shared earlier, we have the talent umbrella. So we are sending people for all the different kinds of training. We are using their trainings to develop similar kind of solutions. So we are ensuring that whatever energy and skills that people already have, how can we channelize to do something new? Because we have to match the pace at which the world is changing right now. And we have to adapt to that technology. So we are using that manpower for something else now. We are putting it into the new projects, or for development of new machines, sending them out of India to learn that what is happening outside the world. Thank you. Thank you. Thank you so much for the time and attention.